Happy Thursday. Thank you for joining us bright and early there on the West Coast. I hope everyone has a cup of coffee with them. And folks are just coming through cyberspace and joining us from the waiting room, I see. As you come on in, we invite you to put on your camera as you are able. This is designed to be a very interactive session and to give you some time and space to connect with those folks who are doing this work in your local area. So come on in and join us with your camera. And I know some folks are still joining us, but in the interest of time and respecting your time, we're going to go ahead and get started. So again, welcome to our virtual road tour on veteran oral health in Nevada. We are thrilled to be here with you today. This is a program that we've been doing over the last year, but this is our first virtual road tour stop of 2025. So thank you to Nevada for being here with us today and kicking us off with our 2025 series. We're excited to get started. I'm Liz Flannery. I use she, her pronouns. I'm the Director of Education and Leadership here at AIDPH, and I'm going to be walking us through our presentation here today. So what are we going to be talking about? I'm going to go through some housekeeping pieces, give you an introduction of who we are as AIDPH, why we have this data and have done this work. We're going to go into an overview of what veteran oral health looks like at the national level. Then we're going to dive deeper into the data in your state specifically and look at Nevada veteran oral health and talk about what that data looks like, what that means, and how you can use the tools that we've developed around that data to make an impact in your local community. We, like I said, have this session designed to be very interactive. So we have some different points to hear from you through polls, through chat, through group discussion woven throughout this presentation. So I hope you take advantage of that and join us in discussion and share your insights from your state. And we'll, of course, have time for Q&A and some additional discussion at the end. And we'll leave you with some next steps and action items. So when you hear about this data and feel activated, you know what to do next. So looking at our housekeeping, we're recording this session. Again, we invite you to come on camera, stay muted until it's time to talk, but it's built to be very interactive, so we're looking forward to hearing from you. The slides, forms, additional materials will be posted to our academy after this session. We'll share links to that, and that's where our CEU information will be available as well. I would like to take this time to invite you to share your email, your organization, and your name in the chat. Again, this isn't just an opportunity for us to share data with you, but an opportunity for you to see the folks who are activated on veteran oral health in your community and to connect with them. So please share your information in the chat, chat with each other throughout, make a connection, share your work so you can connect with those doing this work in your state. If you have any questions about Zoom, please post those in the chat and an AIDPH staff member can help you. As Annalise pointed out earlier in the chat, I think just to me and Sam, but Sam and I are matching today. Sam Lissette's here from AIDPH. You know who we are because we have a uniform of sorts on today. So pop that in the chat and we can help you out with any questions you may have. So again, we're going to engage today. Slido is a platform that lets us post and share polls, word clouds, etc., and show those in real time to you all and gather that information. So we're going to use that throughout this session today. So take a moment. You can scan this QR code. I think Sam's going to post the link in the chat. You can go directly to slido.com and post this number in, and it will bring you to our session with the polls and questions. Again, we'll use this throughout, so I'm pausing for a second to make sure everyone can pull that up. But Sam can also answer any questions and post the information in the chat in case you miss it the first time. Okay, these are our learning objectives. They're tied to our CEUs and they encompass what we're learning about here today. They're available in the registration information and we'll pop these in the chat for your reference. So really, again, we're going to look at some state-specific data. We're going to look at policies and advocacy for reform to bridge gaps in care. We're going to collaborate with local stakeholders. Again, we're going to take opportunities to connect you all doing the work. And we're going to look at strategies on how to look at this problem, the disparities for this population, and ways that we can leverage this data into action. So with that being said, and thinking through our learning objectives and what we're doing here today, and also giving us a little warm up for Slido, we're going to start with a poll to hear from you about what brought you to today's session. So if you toggle over to that website, well, again, it's in the chat. If you didn't open it before, you can look at the link there. And we want to hear from you. Did you come here to learn, share, connect, act, or maybe it's all four of those things? And I'm going to pop over here. This is a good tech check for us. We can kind of see how many 100% of folks who have responded so far, all of the above. I love to hear that. The teacher in me loves to see that. I'll give folks another second or two to respond. It looks like we're staying at all of the above. Okay, I take that to mean that you all are very excited to be here, very activated, ready to engage. So thank you for warming up with that Slido piece. Okay. Continue on. We do not have any disclosures to share from our presenters here today. And looking at our host, I introduced myself. I gave a quick intro to Sam, who's on our team here today to help with support and making sure our information's in the chat and answering any questions we have. I'm also going to shout out, I think Annalise is on our call here today. She can chime in with kind of high-level insights for any questions folks have. And I know Sam and Annalise, I don't have full view of the chat, so if people are chiming in with questions, they will interrupt me so we can pause and hear those from folks. And we also want to give a big thank you to Dr. Keith Benson, who helped us coordinate this, shared this out with all of you in Nevada to make sure you had the opportunity to come and really made sure that we had a good group here today for a robust discussion. Okay. So we are almost to the data part and looking at those pieces. But again, to get us started, we're going to go back to another poll. So if you toggle back to Slido, and Sam, I think some people have been coming in, so they might not have the link from the chat before, if we can repost that. So we want to hear what you believe are the top priority areas for veteran oral health in your state. And also this is, interesting to see where we're all starting, but also it will let us customize our presentation here a bit as we kind of go through and look at the data and talk about what's happening in your state. Okay, again, I'm never seeing another 100%. Is everyone responding and everyone's on the same page? Or so access to care is 100% right now, the top priority areas. We also have options for oral health literacy, workforce development, policy advocacy, integration with general health care. Okay, access to care. We're certainly going to tackle that here today. Oh, I see oral health literacy is popping up there too. Okay. All right, oral health literacy is getting a bigger tag. That's great. We're going to talk about some education pieces that we can do with the data we have. And again, we're certainly going to cover the access piece. So thank you to responding to that and getting nice and warmed up and sharing your thoughts. Okay. So again, without a further ado, I'm going to talk a little bit about how we got to this point, who we are and how we got this data and got to this point where we can share out our insights and the research that we have done. So AIDPH, or the American Institute of Dental Public Health, we're a 501c3 nonprofit organization. Our mission is to empower our community to advance oral health through science, education, and advocacy. We have a research and impact team that does independent research. That's how we got here. We started looking at veteran oral health and realizing there were a lot of data gaps. I'll go into that a little bit more and talk through the body of work we have on veteran oral health. But it started at research, and then we took that research and it informed the advocacy and education work that we do around veteran oral health. And we do this work because we have a vision of a justice-oriented oral health system. We have 4 communities of focus at AIDPH, which include LGBTQIA+ folks, veterans, people with disabilities, and people in rural communities. And of course, we understand that there's intersectionality on all 4 of these communities of focus. Talking about what we're here for today, looking at veterans, we see that approximately 30% of veterans report having a disability, and about 25% of veterans live in a rural area. Something we'll talk a little bit more as we dive into the data here today. And of course, all of our communities of focus have the common experience of historical exclusion and marginalization from healthcare systems. We want to take a moment and thank our funder, CareQuest Institute of Oral Health, who has been a partner with us on the majority of our veteran oral health research work, and who is funding this project to go out to the states and talk about the data in each state of our country on this virtual road tour. So thank you to CareQuest. This is a little bit more insight into the work that we have done with CareQuest on veteran oral health in our research. You can see that we started this work all the way back in 2021, launching some surveys with veteran service organizations directly to work with that community. Our research is always done with a community engaged focus and lens. So we're always partnering with our communities to engage and ensure there's transparency and trust. And you can look through and kind of see the advocacy and the reports that we have published throughout to where we're here today, where we have an upcoming Hill Day with Open coming up here in May. We'll talk about that in a little bit. And again, doing this virtual road tour to talk to the states and make sure folks at the local level have the tools they need. Okay. So now we're really going to get into the nitty-gritty about what we're here to talk about today. And we're going to start with a national overview and look at what veteran oral health looks like in a national landscape, and then dive deeper into the data at your local state level. So starting with that national overview might be familiar for some, but we found, again, doing this work, both doing the research and then taking it out to do education and advocacy programming, we found that many people, sometimes even including veterans themselves, aren't fully aware of how VA medical and dental benefits actually work. Again, repeatedly found that veterans themselves, civilians, practitioners, clinicians really don't understand the eligibility process and what care veterans can receive, or even where and how they can access that care. So that's why we like to start at the beginning by setting the stage with a clear picture of what's currently available through the VA and what veteran oral health looks like at the national level. So here's the key point that we want to highlight. Eligibility for medical and dental care through the VA isn't set by the VA itself. It's determined by Congress and through a federal law called Title 38. So that outlines what care is covered, who qualifies, and how much it costs and where it can be delivered. Because of that, any major change, like expanding dental coverage eligibility, requires congressional action. It's not just a policy or rule update, it involves passing new legislation and securing federal funding to support that legislation. So when we talk about limitations in access to dental care for veterans through the VA, it all ties back to laws at that federal level when we're looking at that eligibility piece. However, I also want to point out that that doesn't mean we can't take action and impact change at the local and state levels. It takes getting educated like we're doing here today, and collaboration with our local stakeholders and communities. So currently, most veterans aren't eligible for dental care through the VA. This row of people you see here represents all 20 million veterans living in the US today. The lighter colored half over to the right shows that the veterans who either receive care outside the VA or aren't eligible for VA healthcare at all. And as you move to the left, I hope it's your left and it's not mirroring. As we look at that darker blue section, it represents the nearly 10 million veterans enrolled in the VA healthcare. But of those, only a tiny fraction, that small blue and red segment we see, is actually eligible for dental care through the VA. And what that means in practice is this. Veterans might go to the VA for a medical appointment to get treatment for a chronic condition, but they leave still dealing with untreated dental pain because they're not eligible for dental care. Additionally, even among that 1.5 million veterans who are eligible for dental benefits, only about a third actually use them. And barriers to care and lack of awareness can potentially play a big role in that. We need some more data and to look into that a little bit more to kind of understand that usage piece. but it's a big part of it. So we're left with a deeply inequitable system. Veterans either aren't eligible at all or face a fragmented oral health landscape that makes it hard to get consistent, high quality care. And we know that this problem is even worse for veterans living with chronic conditions where good oral health is especially critical. We're going to look at that a little bit more here with this data. Veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. And what's even more concerning is that veterans with these high risk, high cost conditions are more likely to lose all of their permanent teeth. And we see poorer oral health outcomes for veterans than non-veterans, even if they've seen a dentist in the past year. So access alone isn't solving the problem. Even when veterans are getting dental care, many still face some of the worst oral health outcomes. And a big reason for that is lack of an integrated care environment. Chronic conditions aren't being addressed in coordination with oral health needs. And that's why it can be really frustrating. The VA is the largest integrated healthcare system in the country. We believe it's uniquely positioned to manage complex care for veterans with multiple chronic conditions. But since most veterans aren't eligible for dental care through the VA, they're missing out on that critical coordinated care piece, which leaves a really major gap in the overall health outcomes. So again, diving a little bit even more into this chronic disease connection piece, we're sharing here some of our recent research conducted again in partnership with CareQuest that really focuses on the connection between chronic disease and oral health. So even after controlling for factors like income, education, whether someone lives in a rural area, we found that veterans with diabetes are still 40% more likely to be edentulous, meaning they have lost all of their natural teeth, compared to veterans without diabetes. And that's a really powerful indicator of just how strongly chronic disease can impact oral health outcomes, even when other risk factors are taken into account. And in that same vein, just as concerning are the findings related to heart disease. Veterans with heart disease were 30% more likely to be completely edentulous compared to veterans without heart disease. And that reinforces what we're seeing across the board. Chronic conditions like heart disease and diabetes have a significant impact on oral health outcomes for veterans, even beyond other contributing factors. So let's talk about that at a healthcare systems level and really highlighting here that it's not just about poor oral health outcomes and reduced quality of life, although of course those are very serious concerns, but it's also about the broader health impact and the cost of care. When dental care is managed as a part of an integrated healthcare system, like what the VA could offer if dental coverage was expanded, there's a clear opportunity for cost savings, especially for veterans with chronic conditions. So some of our research shows that for every dollar invested in dental care as part of diabetes management, there's a $1 savings in related medical costs. And when you look at heart disease, it's even more striking. Every $1 spent on preventative oral health care can result in $2 saved in heart disease management. So at that point, the dental care isn't just a health benefit, it's really paying for itself. And that's an important context to keep in mind as we look at chronic disease trends in Nevada and consider what solutions might look like there. So where is all this information coming from? I talked a little bit about this at the beginning, but I want to remind everyone that these resources are available on our website and at vetdentaldata.org, and we'll pop that in the chat there for you. What you're seeing here is just a snapshot of the research and the tools that we've developed to help organizations like all of you working in different organizations at the state level and others across the country. Access to clear, tangible data about veterans we think is really important for people to pursue change and make an impact. This kind of information can really be tough to find, and that's why us as AIDPH and CareQuest have worked closely with veteran partners. Again, our work is always done in a community engaged manner, and pulled in every available data point we can find from the VA, from national surveillance systems, et cetera. We've brought it all together in one place to make it easier for you to apply this information in your work, which is exactly why we're hosting this virtual road tour here today. Okay, so to kick things off, I'm going to share a little bit about Nevada and give you some background on why we're doing this road tour. We've developed a set of resources available at vetdentaldata.org It includes research articles, state profiles, and report cards, which again, that's what we're going to dive into here is your state profile. We're going to pop those in the chat so you can pull it up and go along. And I just want to point out when you go to vetdentaldata.org, if you hover over Nevada on the interactive map, you'll find a detailed profile that outlines what veteran oral health looks like in your state. If you go to publications, that's where you can find, we're going to post a direct link to your profile, but if you're trying to navigate to it at a later point, you can go to publications, click on Nevada, and find your profile. These were created for all 50 states to provide a specific relevant information that's easy to access and use. We've also built Veteran Oral Health Data Dashboard. That's that interactive map piece so that you can explore the data in a way that's meaningful to you and focus on the issues that matter to your community. Okay, so here we go. Let's dive in. And we're going to pause here, give everyone a second to pause from hearing from me. And before we dive into the state-specific data, we're going to toggle back over to Slido and share one word naming what you think your state's biggest challenge is for veteran oral health. I'll pull that up here for a sec. I see that folks are typing, so we'll give folks a second, but I'm seeing this reflecting back what we started off looking at as our major pain points and challenges being that access piece and resources, which to me ties into that access piece. We can't increase access without the resources to do so. Transportation, cost, funding. I see a lot of connective tissue between these pieces that folks are bringing up here. And resources keeps getting bigger and bigger, which means more and more folks are typing that in. Okay, please feel free if you haven't already responded to continue to do so in this piece as we go through the data. Okay. So what do these oral health profiles look like for Nevada? We put these state-specific profiles together to answer a simple but frequent question that we continue to get, which was, what does veteran oral health look like in my state? When we were talking about everything I just covered at the national level. Again, we popped those links in the chat, so we invite you to pull up your state profile and follow along as we go through this information, and invite questions as we go through, and invite you to think about how this reflects in your own work and how you can leverage this in your own work. I'm going to highlight the most relevant points, but I want to be clear up front, we don't have all of the answers. The road tour is just as much about hearing and learning from you. You know Nevada best, your data, your context, your communities. Your insights help us improve these profiles and make sure the tools we're providing are actually useful in your efforts to support veteran oral health, so please chime in. We've done our best with the data available, and while it's limited, these profiles aim to offer clear, visual, easy to use information that can support conversations and decisions across different audiences. So let's take a look. We'll start at the top of the state profile. We open each profile with some quick context, what's happening in Nevada and how it fits into the bigger picture nationally, especially when it comes to dental care across access through the VA, excuse me. And the key point that we always include, most veterans are not eligible for dental care through the VA. Again, we find that that's a fairly big misconception that we hear over and over. So sometimes we say, are we just repeating the same thing? But I'll say, even for those of you who are at NOHC, this was one of our trivia questions at our booth. And I think even some of our partners that we work with frequently, we're not sure which percentage to put in there. So it's important to keep talking about that, especially to policymakers, funders, decision makers who don't realize that piece. So when you're starting a conversation, it's a powerful place to begin. veterans often don't have another option for dental care. And because of that gap at the federal level, it's states and local healthcare systems that end up carrying the weight, whether it's disease burden, access issues, or care delivery challenges. We've also included data here on where veterans live across Nevada. So if you look across at those at the bottom there in the green, you can look at the counties that have the heaviest concentration of veteran populations in your state. Veterans are more likely to live in rural areas. We mentioned that at the beginning of this call. And as we know, rural communities already face higher barriers to care and worse health outcomes overall. So we can kind of see, again, how that intersectionality of those pieces really starts to increase those barriers. So right up front, we hope this gives you useful county level insight to support better informed local decisions about how and where you're delivering care that could potentially help you improve access as you're looking at those systems change pieces. Okay, so now let's look at some state-specific insight. Here we compare Nevada to national averages because without the context, numbers don't mean much, right? If you're sharing this with a policymaker, a veteran, a program leader, they might not know if 17% is high or low or somewhere in between. So putting it in the national context really kind of level sets those numbers for us and gives us a better insight. So you can kind of quickly, it also helps you kind of do a faster analysis and a faster snapshot of where Nevada stands. Some states have similar challenges or demographics, and as someone working in Nevada, you probably know which comparisons make the most sense. Again, all 50 state profiles are available on our website if you want to explore them further. Earlier, I mentioned chronic disease. Those high cost, high risk conditions like heart disease and diabetes are closely connected to oral health. Because those connections come through strongly in our research, we wanted to make it easy for you to highlight them when you're talking with decision makers or planning programs. So you'll see that reflected here. So in this section, you'll find data on heart disease, diabetes, insurance status, and indentualism, all compared to those national figures. We also ranked each state across those 4 key outcomes. So you'll see where Nevada falls compared to all 50 states. And just a heads up, in these rankings, number 1 actually means the worst outcome, so lower, so higher is better. If you're interested in how we did the rankings or want to dive into the technical details, the full methodology and the data sources are posted on that Vet Dental Data website under the data piece. Okay, so then we go into the grade portion of the profiles. We see the grades individually given for diabetes, rates of uninsured and dental visits, the percentage of veterans in Nevada that visited dentists in the past year, and those combine for an overall grade. And what I want to point out with this portion is to encourage you to not only look at the areas where there's a lower grade, which is maybe our first inclination to look and see where's the obvious call for improvement, but look at those areas with the higher grades and success as well. Taking a look at where your state is succeeding and exploring the why and how you got to that success with that particular aspect of veteran oral health care can give us a lot of insight to a path forward for the areas where we do need that improvement piece. We can take those strategies that led to the success in one area and potentially apply them or a version of them to the next area for improvement. Additionally, you can take that tactic when looking at other states, looking at your neighbor's state or states who may have similar environment. And by environment, I mean veteran population numbers, the government structure, healthcare infrastructure, whatever it may be in that similarity piece. Looking where they're being successful and maybe connecting with those folks can be a really helpful tool in finding successful models and strategies to pursue as you're looking at this data. Okay, so now that we have taken a look, we've heard about the national level, we've taken a little bit of a deeper dive into what it looks like in Nevada. We want to pause and hear from you in the chat. So again, these are based on publicly available data, which we all know can sometimes be limited. So we would love to hear if there is a barrier that isn't in the data, but that you know is real for the veterans in your community that you're working with. Is there something that you see here that raises a barrier to access or other pieces better health outcomes that isn't reflected in the data that we've covered here thus far. And I'm going to see if I can pause for a sec and pop over to that chat and see what folks are sharing. Not seeing anything yet, but I don't think that that means we don't have those pieces. I know it sometimes takes a second to type it out in the chat. Oh, yes, thanks, Annalise. Annalise shares that transportation in rural areas is something that's hard to get data for, but we hear from stakeholders about frequently. I think that's a really good point, Annalise. Something Sam and Annalise probably a little bit of a broken record for me, but I think transportation, particularly working with rural communities, we hear a lot of anecdotal pieces, and transportation always comes up as a public health piece. But what I've really learned doing this work is that transportation piece is really unique to the specific community and the state and the geography. So sometimes the transportation is an infrastructure piece and there's not public transportation and it's just the cost of fuel. But sometimes it's the mountainous overpasses that people have to go and the weather and the snow, and people are unable to afford the snow tires. So 8 months out of the year, they can't travel. Sometimes it's reverse, right? In other climates, it's the summer months and the rain and the other types of weather that we get. So it's interesting to think through how we would maybe get additional data on that and dive into that piece in a usable way. I'm seeing that Dr. Benson is sharing the lack of dental providers and that Nevada has limited Medicaid dental benefits. I wonder, Dr. Benson, are there additional surveillance or data gathering pieces that you think would be helpful to look at that, or that would be helpful in impacting change?
I would say one thing that would be helpful is what percentage of veterans use Medicaid benefits for their dental care in other states that have more comprehensive benefits. That'd be a piece that I'd be really interested to see as our legislature and governor contemplate an adult benefit in this session.
Yeah, I saw Annalise nodding there. I think that that's something that we hear a lot. I think that that question comes up a lot. And our answer, unfortunately, is that we don't have access to the data, but we would love to get additional insight there and encourage support for additional surveillance and data reporting on those pieces. Okay, I'm going to pull our slides back up, but please still feel invited to respond here in the chat as we go along. See. All right, we're going to move into talking a little bit more about how we can use this information that we just went through. And again, I hope it wasn't too much like a fire hose, but these resources are available on the web. These slides will be posted to the Academy afterwards, so please feel free to go through them with a finer tooth comb afterwards. I hope it was informative, but what we really want you to take away from this session is next steps and how you can leverage the profile as a tool in your work, to use the data to illustrate the need, to share the profile, to start conversations, take action to elevate success stories. So we're going to talk about kind of the advocacy, education, decision-making grant, how you can use this information in all of that work. So the first piece we'll talk about is veteran advocacy. One of the most powerful things we can do with data is advocate. And that can look different depending on your role. Maybe you're a provider, a policymaker, a veteran yourself. This profile really gives you credible local data to bring to your city council, your state legislators, or your congressional representatives. You could also organize a listening session in your community and invite decision makers to hear veterans speak for themselves and raise their community voice. I also want to point out that small advocacy actions like calling an elected official, submitting a public comment can ripple outward in bigger ways. So advocacy doesn't always have to mean starting at that Hill Day. Like I mentioned, we're going to DC to do a National Hill Day, and part of what we'll be talking about there is veteran oral health. And that's incredible and important, but it doesn't always have to start at that big piece. There can be a lot more small advocacy steps you can take along the way. So educating to empower. Many people working in healthcare or veteran services don't know how stark the oral health gap is. Again, really just starting with that base understanding that there is a disparity and that it is a population that has a greater need. That's where education comes in. So you can use this profile to lead a short talk at your organization staff meeting. Start with your peers, start with your colleagues, and at that education level. And honestly, that's a bit of advocacy in and of itself. You could brief a coalition, a partner organization, etc. When stakeholders are informed, we believe that they can become allies, and that's how we build momentum. It's really an opportunity to collaborate across silos. So maybe you bring this to someone in housing or mental health or food access and find a way to align your efforts and kind of maybe make those non-traditional community partners as well. So when you're thinking about opportunities to educate folks, think outside of the oral health box and kind of the broader community, and we can really make strong coalitions in that way. We can also use this data to inform our strategic decisions and our strategic thinking. Whether, again, I think a lot of us on this call probably have a variety of different roles. Whether you're leading a nonprofit, managing a health program, advising on policy, you can use the data in the state profile to decide where you want to focus. Again, looking at that location data, maybe there's a rural county with no dental providers or a population group at higher risk. It also helps make the case for why you're investing resources and where you are. And if you're doing evaluation or reporting, it gives you a baseline. So if you want to implement a project and really show that you're meeting your objectives, this is baseline data that you can leverage for that. Here's where we started, and here's where we're trying to shift to and get to. And in that same vein, we can leverage data like this in the profile to bring in resources. So grant funders and grant makers and funders, they want to see data and they want to see it grounded in the community. And we believe that state profiles can be a basis for that. So you can use it in a problem statement for a grant proposal or to show the gaps in care. You can also cite it as a foundation for what your solution will address, as a benchmark, again, measuring those outcomes and deliverables if you're writing your report, really kind of pulling in those pieces. So those are some ideas. I hope they spark some activation for you, kind of thinking through the programs that you do and how you might want to leverage this data. And with that being said, we're going to pause again for another discussion point, thinking about those different uses for the state profile, advocacy, educating stakeholders, using it for grant reporting or decision making. We would love to hear which one feels most relevant to your role and or your organization. And if you want to share your work more as you answer that question in the discussion, we would love that. I'm going to stop sharing, and I invite you all to come off mute and share that piece. And I guess I would also say, I see something from Dr. Demopoulos. If there's a pain point that you have that you don't think this would solve, we would love to hear that too. Dr. Demopoulos is sharing grants and educating stakeholders feels most viable. We have a veterans clinic at the school, but funding is limited. So the amount of services provided is limited. That makes a lot of sense. And maybe these numbers can kind of highlight the need a little bit more for that piece. That's really great. Thank you. Dr. Benson, DHCFP is always looking for grant partners that can help with oral health in Nevada. I am not, so maybe all the Nevada folks know the acronym. Dr. Benson, can you share?
Sorry, that's the name of my division. It's the Division of Healthcare Finance and Policy, which is Nevada Medicaid. Sorry.
Fantastic. Thank you. We are, we are very acronym heavy here at AIDPH, so I am always guilty of that piece. Let's see. Michael says they serve on the American Academy of Implant Dentistry Foundation Board as well. There are resources available for implant dentistry for edentulous patients. Happy to jump on camera to discuss. Yes, we would love to hear more about that. That would be great.
Everybody, some of you, I know we work together at UNLV, some of us meeting you for the first time, and we've had some interaction here. I'm a prosthodontist and implantologist, and I also serve on the Veterans Foundation panel for the American Academy of Implant Dentistry. So the interesting thing that I've seen over this, and I've been serving on that committee for about the past 2 years. I'm an instructor at UNLV, also in the GPR clinic there. And the one thing I've noticed on the board is we get very few submissions. So the awareness and the access to care thing that I know I've seen is interesting because there are financial resources available. So please reach out to me, and I'll post my email on here, and I'm happy to serve as a resource to anybody. And available for our veterans that don't have the access to it as well. And there's very little, there's no hooks or ties to it. It's literally just you go and you get treatment done at your local dental office, and there's some grant funding for it.
That's really fantastic. Thank you for sharing that out. Are you okay if we share your resources with the recorded information as well?
Oh, with my contact information?
Yeah.
Yeah, that's perfectly fine.
Okay, great. We can follow up via email too, but
Thank you very
that's
much.
fantastic. Thank you so much. Okay. All right. Again, I'm gonna go, I see one more message here. Oh yes, perfect. Okay. I'm gonna go into our next few slides here, but please, if you have additional pieces you want to share, please continue to post those in the chat and chime in. Okay. So again, hearing from you, we're going to launch another poll talking about the resources. We just talked a little bit about what feels viable and how to leverage this information. But we want to be leveraging these tools in our research to best serve the work that you're doing. So again, there might be something that you need, a pain point that you have that isn't being served with this. And we want to hear from you about what additional tools would be most helpful to your work. So we're going back to Slido. Sam is launching that poll. So if you toggle back over to that piece, we'll take a look and see. So we're wondering, is it educational materials, policy brief, research findings, training modules? What would be helpful additions to your work? Policy briefs. Okay. Give folks a second to respond here. And this is another one too. Research findings, great. Where please, if we toggle off of this in the next few seconds here, please make sure you respond because we will look at this afterwards, and this really does inform the work that we do. And when we look and see, when we're talking about data gaps or the community, we need, our mission is to empower our community. That is you, the dental public health workforce doing this work at the local and state level. So we really use these conversations to look at what to inform what we are doing and what we are producing. So we appreciate you taking the time. I think some folks are double tapping on that policy brief piece. Okay, we'll toggle back over. But again, if you haven't responded, please feel free to do so. We really want to hear from you. We also want to take a second and highlight what some additional deeper work can look like when you examine veteran oral health at a deeper level at the state. And just want to take a minute and share that we have had the opportunity to do that in Iowa. We have now been working in Iowa specifically for several years now, actually, where we started with a very in-depth research analysis looking at veteran oral health in the state, and published end of 2023, early 2024, a very comprehensive, I think, 75-page report on veteran oral health in Iowa, along with strategic recommendations there. From there, we had the opportunity to engage with their local stakeholders and community even further and bring those recommendations out to the community in discussion through virtual forums and an in-person summit that we conducted last year. And most recently, we've been working on taking their feedback and insights on that work and developing it into a strategic plan that stakeholders in Iowa can follow, a really stepwise laid out plan to look at the need and look at the resources that are in the state and the stakeholders in the state and the strategic recommendations, leverage the resources that are available and follow a plan to actually take action on those strategic recommendations and begin affecting even more change. So there's some really interesting things happening in Iowa. Iowa is also a piece, and these are strategic recommendations here, and you'll see us kind of highlighting building out the trust fund. Iowa is really interesting because they have some innovative solutions for funding and access that are not tied to Medicaid. And some interesting systems. So they're also a case study when folks on these calls bring up what are success stories that you've seen, what are other folks doing or other states doing. Iowa is something that always comes to the forefront, and we encourage folks to take a look at what they're doing in Iowa. It's pretty innovative, and they're finding some great success there. Okay. So again, we've had several points of discussion throughout, and we want to take a minute to explore some additional pieces. But I'm going to pause before we really dive into some additional discussion. I want to pause and see if there are any questions about the data we covered here, or other pieces about the presentation that we can answer before we move into more discussion.
I have a question. I'm sorry.
Yeah.
Yes.
No, please.
So you mentioned that roughly 9 million people are enrolled with VHA, and out of that, only 1.8 are eligible for dental services. I just wanted to know what qualifies these members to become eligible to receive dental services.
Yeah, so it's pretty complicated. Kind of the short answer is eligibility is dependent on a variety of things, but mainly disability rating. Disability rating is anyone getting out of the military service gets a certain disability rating. It's a fairly complex process. I think something that maybe I should have started the call with, I just happen to be the spouse of a military service member. Annalise is also the spouse of a veteran. And so, that doesn't make me a monolith on veterans or service members, but I do have a little bit of personal experience anecdotally. It's a fairly complex process, and it can be very confusing even to the veterans themselves. But that disability rating, by and large, can dictate eligibility pieces. And for dental specifically, it needs to be 100% disability rating. There's a few other pieces. If you have a service-connected injury that is related to the mouth, etc., there can be some eligibility around that. Again, it isn't exclusively that disability piece, but it's by and large that. We saw actually an uptick in veterans being eligible for dental care through the VA in the past year and a half because of the PACT Act. The PACT Act didn't include specific pieces around eligibility for dental, but what it did was it increased the amount of veterans that had that 100% disability rating, and then connected to that, therefore, more veterans had eligibility to the dental care through the VA. So does that help shed a little bit of light? I know I'm kind of giving you an answer that it's just very complicated, but I hope that kind of gives a
No,
little
that
more
was good.
insight.
And also, Dr. Benson looks like put something in the chat. It was
Yeah.
it was very helpful. Thank you so much.
Yes. Perfect. Any other questions we can answer?
Can I just add on to that a little bit,
Yes,
Liz?
please do.
It was very surprising to me. In my residency, we did a 6-week rotation at our VA in Albuquerque, and we had so many patients that they'd only get limited treatment, and that was because they didn't qualify under the CFR that I put in there. Just it was very surprising to me that some of the qualifications were like being a prisoner of war at one point. Um, and then, of course, like you talked about, the 100% disability, but also combat wounds. But those combat wounds had to be to the maxillofacial process. And so we would turn away folks who were obviously disabled in some way due to actual wounds in war. But then you would have to have actual wounds to the face or mouth to get treated. And the treatment was incredible that was provided, but it was very limited, which was um, very eye-opening. I just wanted to share that. Thanks.
Yeah, it's a great question. And again, ties back to that piece why we kind of focus on so much that um, eligibility doesn't exist by and large, because it is surprising to folks. Dr. Benson, did you have something additional?
I just wanted to give an opportunity. I don't know if Demi was able to make it onto this meeting, but he runs the local Adopt a Vet chapter here in Reno, and they just opened like a fantastic clinic in the middle of Reno. And he speaks about he knows everything so much better than I do, so he really speaks to what's locally happening in the Reno and Las Vegas area. But I don't see him on here. He must have had a conflict, but. I just wanted to say that they have this clinic and they're looking at different modes of helping to fund that clinic. They have volunteer dentists. They also lease out space as they have a surgery suite. They have many operatories in there. And so I just wanted to kind of, you know, point him out as someone doing a lot of work in this space in Nevada.
Yeah, that's also fantastic. And perhaps we can grab that clinic link from you or resources, and we can post those with the recorded materials if that's okay. We can follow up for that. Okay. I am going to go back to our slides for a second, but if you have an additional question, please chime in as we're going through kind of our closeout pieces here. Okay. So we want to leave you, we have a couple kind of next steps and calls to action, but we want to leave you with a really simple piece that we hope everyone will take. We hope you're feeling activated. But like I said, I know it's a lot of information to take in, and we're all busy. It's busy. It's a busy time of year. For some reason, I think, well, spring is busy for everyone. And for some reason, I think for dental, we find that everyone has a lot of events and travel built in as well at this time of year. So I want to leave you with one concrete, easy step to take after this session to keep the momentum. And if you're feeling activated, to kind of move forward on that and keep your momentum. And that is to share the state profile with one new person or organization. And if you're willing, I would love it if you post in the chat who you're going to share it with. It will help us keep each other engaged and encouraged, and just let us know who you will share that with as your activation point post call here. Okay. To talk a little bit about next steps and some housekeeping pieces, CEUs are available for today's session for attending. They're hosted on our Academy, and Sam's going to post that link in the chat so you can follow through. Many of you, I think, are probably already signed in at our Academy. If you're not, you do have to sign in. But that will also allow you to keep track of any CEUs you earn with AIDPH all in one spot, which we think and hope will be most convenient process for you. As I said at the top of this call, recordings and resources from today's session will be available on the Academy. I know some folks posted some things in the chat, and then we had some follow-up on some links, so we'll gather all of those and post those again so we can kind of make the most of that local activation and those connection points for you all here today. The research and the resources that we looked at are all located on vetdentaldata.org. We hope you visit that site often, and always please let us know if you have any questions. I also mentioned that OPEN, our Oral Health Progress and Equity Network through CareQuest, is having a Hill Day coming up in May. And I wanted to share that with you. Attendance to attend that in person is closed, but there are opportunities for folks to activate virtually. So we're going to share OPEN's website with you. You can take a look at that. The other piece I want to point out there is that we will be talking about veteran oral health. We will also be talking about Medicaid, and we will also be talking about oral health access for people with disabilities, particularly through the Heads Up Act. And so OPEN, with a variety of community members, are hosting advocacy trainings on those topics. They are also doing some pieces around federal health agencies and water fluoridation. So if this is a topic that is of interest to you, if you are feeling activated about getting involved in advocacy, even if you are not attending the Open Hill Day in person, those trainings are available virtually. They are free of charge. The links to sign up for those are available on the OPEN website that Sam posted in the link. So it's a great opportunity for some additional learning. If the advocacy piece is something you want to learn more about and take action on. Okay. The other piece that we are going to pop in the chat here is this is available on vetdentaldata.org, but we're going to link directly to it, and that is a veteran oral health story form. We have that posted. I mentioned that we always conduct our work in a community engaged way, and this is an opportunity if you are a veteran or you know a veteran who wants to share a story of their oral health journey or the oral health challenges that they have faced. We are inviting folks to share those there on that form. And that allows us to share those stories and amplify that community voice in the advocacy work that we do. So when we're going to those offices during Open's Hill Day in May, we'll probably go again this fall when we're having those discussions, we can weave in those community voices and those stories, and they inform our mixed methods research and they inform our advocacy work. So we're sharing that as well. If you yourself are a veteran or you know someone who would be interested in sharing. And without further ado, we're ending that veterans deserve equitable oral health. So thank you again for being here today. Thank you for engaging. I'm just checking. I think this is all Sam posting our pieces. Okay. All right. So again, thank you everyone here today. Please follow up with any questions you have. Always feel free, questions about resources. If there is work you're doing that you think that we should be aware of or want to partner on, please reach out and let us know. We're always happy to hear from you. And we will see everyone soon at a variety of different events. Have a great day, everyone.
Thank you.
Thank you. Bye-bye.